ke a le dumediša go tswa go lenaneo la rona ezempilo tswa motakalo with Dr. Prue. Lenaneo le bolela ka malwetši kakaretšo ao re fokola ka ona. E tlo thuša batswadi le bana ka moka go ba ruta ka go fapafapana gwa malwetši. Nongonoko lo o ta pfuna ngopfu eka vana lava endlaka grade 11 na grade 12 lava va lava ku yisa tidyondzo ta vona emahlweni, ku nga va vudokodela, vuongori, vudokodela va marhambu na madyelo lamanene. Kanti nabo bodokotela bethu abasebecedile community service yabo abafuna ukuqhubekisa ukuspecialize ngama-specialties ethu ngokuhlukahlukana kwabo. Lolu hlelo lizobanceda kakhulu. Namhlanje sibuka udaba olubaluleke kakhulu emzimbeni yethu lokuthi kungani sifaka ibuko, kungani singaboni kahle. Kanti izihambeli zami namhlanje kuma-studio ngine-ophthalmologist ne-optometrist abazochaza kabanzi ngalolu daba. Yimani audience Maluleke nakona shiteka kari engakanani kuba optometrist.
Na kensa Dr. Prue. Vito ra mina I audience Maluleke ni optometrist kunga ngaka ya mahlo. Ni na malembe yo ringana 20 ni ri karhi ni tirha as an optometrist. Ni qualify University of Limpopo, then the North. Mo ri ba rutileng ka ka bona bo kudi ba mahlo as in optometrist, and butsia na go ka nang 4 years gore o ba optometrist. Aka karoswan ne van khani tira la Randburg in private, and I have participated in a number of leadership positions within the profession. La ninga etelaniva president wa South African Optometric Association.
Okay. Today, Rishabataba, also boni pila, mo matlong. Ki eng pila bled vision? O ka itlhalosa wa reng?
Bled vision subula loko munhu anga koti ku vona kahle loko kuruku loko langute kumbe akule kumbe akusuhani u hetela u nga swi voni kahle u twa nga ku na nkungwa kumbe ku na khuri. Sweswo swi nga vanga hi ti-reason to hambanahambana. Ti-reason ta kona leto hambanahambana ta kona ku nga va uncorrected refractive error. A ni nga swi koti ku yi hlamusela hi Xishangana kumbe hi Xisuthu kumbe hi Xivenda. Mara swi va swi kha swi vulavula hi ku va munhu a nga voni kahle akule kumbe akusuhani kumbe ku nga voni kahle ku ya hi ku va malembe ya wena ya kha ya hindza 40. Swi nga va kona again loko ku ri na vuvabyi byo karhi amirini. And I think we'll unpack the kind of conditions that can lead to bled vision.
Ungaqhubeka nje usichazele ukuthi yini ebangela noma ekhosa ukuthi sigcine sibe nayo bled vision.
Tshifhinga tshiṅwe zwa itea uri muthu aba a sa vhoni zwavhuḓi nga uri una malwadze mivhilini zwo fana na u vha na cataract, and cataract ri tshi lingedza u i ṱalusa zwi khou amba uri u nga ri ku na papa leri nga kona leri pfalaku ku munhu a nga koti ku vona ku ya mahlweni. Swi nga endleka ku va ku ri ku mahlo a ya voni kahle ku ya ku na swo fana na vu conjunctivitis, ku fana na vu dry eye ya endla ku vision yi va bled. Swi nga endleka ku munhu a ri na bled vision ku va ku ri ku amirini wa yena ku na mavabyi yo fana na vo diabetes, which will lead to diabetic retinopathy, and I think Dr. Phathudi will continue to unpack the impact of diabetes, high blood pressure, and strokes, transient ischemic attacks that can lead to blood vision. So, swi swo tala leswi nga leader ku hi nga koti ku vona kahle. Na loko mkhami leswi nga tshama swona lawani ni mboni loko mi languta foni ya n'wina a ma hi langutela kusuhani lawa mi langutele kule le sweswo swi vangiwa yini a ku va vuvabyi byo karhi i nkarhi wa koho wu nga fika. Life begins at 40, so loko u fika ka 40 ku va na leswi swi vitaka presbyopia mi va mi nga koti ku vona kahle.
Hi xini la swakudya leswi swi endlaka umuntu agcine angaboni kahle noma ukuphi ukudla esingathi masikudla kusincede ukuze sibone better sibe ne better vision? Leswi nga important leswi nga na nkoka ku hi swi teka hi swi twisisa ki taba ya gore a healthy body is all important. It's a combination of factors. So loko hi ku leswi nga good for mbilu is good for the rest of the body. It's quite important because akuva na swakudya leswi nga ku hi nga swi pinpoint ku leswi wani swi endla ku i nga voni kahle mara loko ku lifestyle hinkwayo yi komba yi nga tshamisekanga swona u nga va na mavabyi lawa hi nga vulavula vo diabetes, high blood pressure lawa nga leader ku vision ya wena yi va yi ta affecteka. So ku na swakudya leswi hi swi tivaka ku swa pfuna ka ku va mahlo ma va ma hanya ri kahle to the extent that we say green leafy vegetables are good, your spinach, your kale. We say food such as fish, tuna, they are rich in omega-3 and amino acids, including antioxidants. So swa pfuna ka ku ya ka ku va swi kha swi endla ku eye health yi va yi maintaineka. Okay. And then Lina as optometrist or motho ha le go high because ra tseba hore batho ha ba tshwere ka mali ba na lo shiana ba ye pharmacy ba reke dilo mola le mola ba tshele matlong o ka reng what do we call it, over the counter medicine o ka reng go bathong bao ka di
ditlhare kaofela di a thusa mara di thusa mo e leng gore di tshwanetse go thusa gona se se ra gore setlhare se e leng gore se tseditswe gore se tlo thusa ka conjunctivitis se ka se kgone go tlo thusa ka glaucoma for an example. So go ba kaone gore re tsebe gore ke eng ntho e leng gore re sokola mo ke re sokola ke eng ntho e leng gore it's a problem ka mahlo a rona before re ya go shanela ko chemist re fitlhe re ithekele medication o leng gore available. The doctor, they are there to diagnose, manage the conditions and the associated risks. Because what is good for me may not necessarily be good for you and for him. As a result, it's also something se leng gore se common ra se bona mo e leng gore ha nkgono ka buile le medication from whenever from a doctor our verification then our right ha nna le nna ke utlwa le tlhoka re la hlohlonya ke ya gona mo le go tsia setlharsela ndana ke se tshela a go right ka mkho because nkgono ne ba mo hlahlubile ba tla ba khona bona re bothata ba hae ke eng. And then wena because ne ona le allergy yana then wa no tsia setlharsela se ileng gore se tseritse gore se thushe ka glaucoma for an example tla bo o tikgobatsa. So who important gore re tle re tsebe gore bothata bo nna re bona ke bo bofi gape ke eng medication o leng hore o ka o user. Over the counter medication ho ya ka nna a wa eletsa gore re tle ro abuse ka gore o available o teng o etseditse for circumstances where you have already been diagnosed, you already know what the conditions are.
Nka rata ho tseba hore lena as optometrist bolwetse bo ba ho se bone pila le bo alafa bjang.
Kuna tindlela to hambanahambana leti nga ti tirhisaka swi ya hi ku problem yako hi ncini. Kuna ku u nga voni kahle i nga kota ku endla ti-glass i nga kota ku u mbala ti-contact lens loko ku ri ku a wu voni kahle ene ku na vuvabyi lebyi nga koho a kota ku laha hi nga fikeleleki hi ku ndlurisa hi ku referela kwihi ka other professionals such as Dr. Phathudi lawan as an ophthalmologist because he as optometrist I go to nga endla swin'wanyani swo fana na vo ti operations and other therapeutic interventions. So loko ri ku a hi koti ku va hi nga ku endlela swona as optometrist a ku hundzisela mahlweni for further care. Nkarhi wun'wanyana u kuma ku va na blurred vision based on ku kuna systemic condition leyi nga kona a ku vuyisela ka your general practitioner at the primary care level va fika va ku pfuna ku ya mahlweni. So ti-intervention leti nga kona ti tele ni vulavula ti specs ni vulavula ti-contact lens laser yi kona operation yi kona so hi swona sweswo hi swi tirhisaka swona.
Sibonge kakhulu Mr. Audience Maluleke. Before singaqhubeka ngohlelo lethu Dr. Phathudi o ka mo tlhalosetsa wa reng motho a dutseng hae hore ke mang Dr. Phathudi and ho ba ophthalmologist ke eng pila kanti ho tseya sebaka se se kana ho ba ophthalmologist.
Ke leboga sebaka Dr. Blue. Well, Phathudi ke ngaka ya mahlo an ophthalmologist ke bele go sekhukhune le ke tswa bona Limpopo mara ke goletse Pretoria so ke bile matlatsi ka go sepela dipoleke tse dintši ka baka la mebereko ya batswadi ba rena ke bile matlatsi ka godishwa ka lapeng la batho ba e leng gore ka batswadi ba e leng gore ba rata thuto and ge ntse re gola nna le batho ba ka re godisitswe ka yona tsela ya gore thuto ke yona go ya pele and ka baka leo ka ba le interest ge motho ntse a gona ka ba le batho ba e leng gore ba ntlhotlheletša gore ga be le go nyaka go dira tša bongaka tsela shi. I was fortunate ke na le also a cousin brother who is also in the field ya yona medicine le yena o tokile tsone tša mahlo and le yena o ile a kgona go ntlhotlheletša go tswela pele gore ke fitlhe go ba an ophthalmologist. Now go ba an ophthalmologist motho tshwantse gore a tsene sekolo sa bongaka a dira yona MBCHB which is usually about 5 to 6 years. Go tloga fao tshwantse gore a dire at least a few years of GP work. I did a tseba internship ya mengwaga mebedi ya community service. So that's an extra 3 years after your 6 years. So we are now at 9 years. Go tloga fao ba bantši ba rena re ile ra ba di GP ka di clinic tša mahlo for at least a year or 2 years just go bona gore na is this something e motho a ka tšwela pele ka yona. Ke bile matlatsi ka hwetša mošomo as a GP ko Mankweng hospital ka bereka gona for about 18 months or so. Go tloga fao ka hwetša post ya go specialize in ophthalmology Bloemfontein. So go specialize is an extra 4 years mo motho a thomang fase go ithuta ka leihlo gore na leihlo ke setho sa mmele se se jwang se sepediša jwang le mmele ka moka ka mokgwa audience ba se tša re tlhalosetša gore leihlo ke setho sa mmele, it's not independent. So se selling good for mmele wa gago, se good for your eyes. Se selling bad for mmele wa gago, se bad for your eyes. So after that 4 years, and during that 4 years, ba re ruta go operate malwetse a mantši di operation tše di ka thušang batho gore ba kgone go bona gape. So it's a lengthy process, mara ke process in gore it's well worth it at the end of the day.
Since I tlhabisitse audience ka di courses, ke nyaka o re tseye bjanong gore he ke utlwa nkare ke bona bleeding yana ke bone pila. Ke tse feng maybe the symptoms tse dingwe tse tsa gore now a ka tshwana o šianela pharmacy ka yo reka ditlhare mara he sentse e le blood vision e na le di-symptoms tse dingwe tsa o tshwana o tla re botsa gore tse tshwana le tse feng tshwanetse eo re bitsa ka gore ke emergency o tshwanetse o bonane le dingaka tse tshwanang le leng.
Absolutely. Yeo ke potšišo ya bohlokwa because matlho modimo re file matlho a mabedi. Matlho a mabedi a sepedišana. And gantši ge leitlho le le tee le sa bone gabotse mara o bona gabotse ka le lengwe, batho ba bantši ba nana gore ke ntho e nyane e tla sepela e tla tloga. As long as nna ke kgona go bona, ke kgona go sepela, ke kgona go ikapeela go ya shopong go boga, ga gona bothata. And bothata bo thoma gona moo ka gore ge o sa checke matlho a gago go tswalela le lengwe wa checka wa tswalela le lengwe o se bone gore gape le a le bone. So that is the one problem. The emergencies gantši tše rena re di bonang ka di-rooms tša rena ke batho ba leng gore they are experiencing pain or both eyes, matlho ka bobedi, vision ya bona e theogile. Only then most people ke gona ba bona gore ke tshwanetse go bona ngaka ya matlho or ke hwetše thušo to bona gore na bothata eng. And unfortunately mo matlhong o kapa malwetse a matlho, once o fitlha mo staging seo bona gore ga o sa bona gabotse o ka hwetša le gore it's too late le rena gore re ka le thuša. So nna gantši ke re o se ka emela gore emergency be gona go ka bona gore pono ya gago e theogile for whatever reason, especially if ke something e le gore e tšwela pele after a few minutes, after a few hours, o tshwanetse gore o bone gore na o bona ngaka, especially if ke gale kapa a so ka o checkiwa matlho a gago. Ge motho ntše a gola, we normally say from the age of about 40, because ke mo bolwetse bo re reng kapa a se bolwetse, it's a condition, an aging condition e re reng ke presbyopia. Gantši ra tseba gore e thoma around about the age of about 40. My recommendation more a lot of my patients le malapa a bona ke gore once you reach that stage, it's always a good idea or fellow or check a month, even if it's a once a year off thing. Or check out your presbyopia, or check out now on the malwetse a mang gape na. Mara what about potšišo ya gago in terms of emergency, o ka bona pono ya gago e ile fase. And o bona gore ke ntho e leng gore ya persista even during the day. Kapa ke ntho e leng gore e tlhagelela tšatši ka letšatši. Go botlhokwa gore o hwetše thušo o ye ngakeng o bone gore na ba ka se kgone go checka gore bolwetse bo ba matlho bo ka se o fofatše na kapa ke ntho e leng gore ka e treata.
Bjanong go na le malwetse a tshwana le bo diabetes, hypertension, stroke, ra itse gore malwetse ao a affecta leihlo. O ka re tseya bjanong o re botsa gore mo structuring sa leihlo a irang pila malwetse a.
So very important question. Gore malwetse a o tshwana le ao a mentioning, diabetes especially. Bolwetse ba sukiri bo foufaditše batho ba bantši and bo sa foufatša batho ba bantši. Even with the technology e ntshwa e re nang le yona matšatšinyana, batho ba tšea nako go yo bona ngaka ya matlho kapa go hwetša thušo ya matlho. Go na le sukiri o tshwanetse o make sure gore number one, ditlhare tša gago tša go thuša go theoša sukiri ya gago gore e be at the right level, diet, exercise, all those things tše ba le botšang tšona from where your GP or your physician, they are very important. That's the first thing. Sa bobedi, if o neglecta bolwetse bo ba sukiri kapa o sa tšee ditlhare ka nako kapa o mesa di-dose tša gago, sukiri ya gago e ya fluctuate, ya godimo ya fase, ya godimo ya fase. When that happens, Also, on a level cheji, sukiri and chikagaraga metsi, metsi are thick, as upon our floor awards. A similar structure where if sukiri is low in your bloodstream, I wish oxygen, the tongue jam me. That's why I took quite a lower mouth to asa awards, the amputation. That's why I took quite a stroke, that's why I took the heart attack. Lema from Kavaka Labore, kiss it to some meal. Lona are affected because asa oxygen enough. A young matlo. So matlo are in a constant state of ischemia or only oxygen enough to support the structure and the functioning of matlo. And kavaka leo matlo arena ana linked VEGF, vascular endothelial growth factor. It's a long medical term, but what it means ke ka mo gore bopilweng ka ona gore ge se thosa mmele se sene oxygen enough mmele o dira blood the new blood vessels or more blood to that structure, and that's where the problem starts. O thoma go bleed ka mo matlhong o no khwetsa o sa bone o le blank on one morning. It's because you might have madi ka mo matlhong, and as a result you have to go and do an operation sometimes to remove madia or madia. So, se go look at sukiri, is under control. Enough oxygen, not only to your eyes, but to your brain, to your heart, to your feet, and the kidneys as well. We must not forget the kidneys. That's why sukiri is not under control. They can end up in renal failure. Okay. So, in a nutshell, that's pretty much what happens ka bolwetse bo ba sukiri. Gape se sengwe batho ba bona le sukiri, they have a higher risk of developing the cataract. So you tend to find younger people ba e leng gore ba ba le cataract. Cataract ke ntho e leng gore normally it's in the older patients, 50, 55, 60 plus more cataract e thomang gone. But if o na le sukiri, and especially is under control, the cataract much earlier in your years. So that's as far as diabetes is concerned. Hypertension is the same thing. What happens more in terms of the stroke happens in the eyes as well. So the blood pressure if stress to the blood vessels. So blood pressure here, the blood vessels and then it enough oxygen, completely into a stroke. So just as you can get a stroke, you can get a stroke. So the blood vessels, the chica supply and the blood pressure they can get a stroke. It can also lead into things like glaucoma, where you get things on central retinal vein occlusion. The model what structures we are looking at for both sukiri and hypertension. This part here orange the retina. Retina orange the blood vessels. The supply oxygen to the structures of the eyes. So the chica the stroke during central retinal vein occlusion or branch retinal vein occlusion and the cause our motor blind. Alright. And the optic nerve is a supplier connecting lico to the brain. So lower namo blood pressure is not well under control. So the structure affected mo malwetseng ao a tshwana le sukiri le high blood pressure.
Re sa continue ka malwetse. Ke ra tseba hore batho ba HIV AIDS ba na le hore ba shape ke ntho e re e bitsang ka leme la go strateng ro shapile ke lepanta. What they call it in medically, it's a herpes zoster ophthalmicus.
Absolutely.
A go re tseye mo hore o iragala ka mo.
Right. So herpes zoster ophthalmicus ke bolwetsi bo ka mo go tlhalositseng ka bona ba bantši ba le tseba as lepanta. So it can affect the V1, but the first trigeminal branch, the ophthalmic branch of the trigeminal nerve. So Ranji, it's only on one side of the eye. So it respects the midline, number one. Salvage, Ojwa the show. On that one side being affected. And it can affect the leaf itself. Can the keratitis, only uveitis, so ke virus. It causes a virus, ye is a touring mommelin. Virus ye renke herpes zoster, I touring mommelin. It's only shingles, shingles. So it's the same family of viruses. Ye it causing that infection. So it will have more than nerve for the rest of your life. I chlorine melin. It la fela her immune system ya rena e theorile go tshwana le batho ba ba nang HIV kapa le batho ba ba gotseng kudu, elderly people le bona immune system ya bona e fela e theoga le bona ba hwetša this herpes zoster ophthalmicus. But having said that, Lego only HIV, but only more the ARVs, at least that will improve your immune system, and it does not necessarily mean you will always have that herpes zoster. So in my practice, I've also been an HIV clinician before. Most the patient getting warning, but with herpes zoster, they were not diagnosed with HIV, and when we do the test, we find especially the younger patients. By long they are HIV negative, usually give out to us and what about herpes zoster ophthalmicus generally vitally sequile or about to affordile. The shojela di chlorile, ona le di sequile or matata a travelang tabacala infection of one and yon. Quetelo in chinchijao, Alisa le camco de legaron, Alisa le straight, di clavalico, tabacala. Scarring. So they cause the scars on the cornea of the eye. They cause dry eyes as well. Makraka are very dry. Kavakala, disca, kapa, mavadi, avangona after that infection. And then another thing religion post-hepatic neuralgia. Only pain away kwang. Leron to a few months down the line. On that area that was affected. And those things can become a problem lifelong after that kind of infection. Treatment only the patient for about 8 days or so, during a cycle, and only the ointment the make sure what the infection is affected.
Thank you so much, Doc. I want to say, wet macular degenerative, dry macular degenerative.
Right. So, age-related macular degeneration. So, age-related already, so elderly population, number one. Will affect that orange part, the retina, but especially the specific area of the macula. Now the macula is more for color vision, for clear vision. It's a very small area, or more molecule. Anything that happens more that area of the macula, it affects central vision around immediately. You can notice it. Unlike Maluleke are affecting the outer side of the eye, So age-related macular degeneration gantši ke bolwetši bo e leng gore bo affecta batho of Western descent kapa white population more than the African population. That's the first thing. And genetic problems. So if you have a family history, kapa gona le motho o mo tsebang o ileng a ba le yona AMD, you might be at a higher risk of developing age-related macular degeneration. Now, the dry AMD, dry means there's no bleeding. And it is fortunately the most common form of AMD. Maraliona, it can still affect your central vision, but not as much as your wet AMD. Wet AMD, it's bleeding. And once you start bleeding, then you need to be treated immediately. Now, treatment is with injections. Injection recover molecule, anti-VEGF. The very same thing, VEGF, in that it plays a role on more AMD, age-related macular degeneration. So the injection is anti-VEGF and it's something that is unpleasant for the patient to get into, but it's something that is necessary. Or reassuring get the blood vessel, but the chica and bleed up. So ready for the injection or at least Oscar bleeder going forward. So Kiona treatment wet AMD. One of the multivitamin, but Wakali Shumishan, one of the studies Jedinja one chavore, but Waba Shumishan, the multivitamin Jamkutao. I did stop the AMD, but the improver or Oscar progressor. The risk factor ever clock mentioning the smoking, but they smoke a lot, they can progress from dry AMD to wet AMD, and the AMD can be much faster and much worse. So smoking is definitely one of the factors, factor about AMD.
Since it's all Dr. Phathudi, since I decide I'm going to go ophthalmologist, kicking up a
So, some tomo, reclo tlatova, reclo checka matla, on a machinery, reshumisha, on a equipment, machinery, rovian, rovia mo machinia or a rebona or na, tata vaga, bumokai. Erika Pajor, give tata mama to wait or a operation, the Balswanale cataract. We can do a cataract operation, and Baba Chiva writes as Oscrapa Litlo. Oscrapa Litlo is an operation. So, Veraka Litlo, Oncha cataract ye, Mararin Chifela, essentially lens yenswa. Lens ye, your night lord Tushan Bobona, or your William. Arrange your nidula Calitlo. Capahona Lemaluchama, Maltonel glaucoma. Offer the clare or a controller, which Boba glaucoma or a Oscar fofage. So, we are covering various federal platform or now Tata Mokai and Kahana Wutushaka. That's in
the Dr. Phathudi. Sasi Koka, Mr. Maluleke. Siyazi ukuthi abantwana bahlalela ama-computer, bahlalela ama-games, bahlalela amafonu, ngisho nathi emsebenzini sesihlala ku-computer, ngisho noma sifunda manje we write our assignment from the computer, and definitely it's affecting our eyes. What is happening exactly, and what can you advise?
With all that you just explained, it is actually been declared or confirmed to be actually causing a public health crisis, especially with children, that the continued exposure the visual display terminals, be it cell phone, PlayStations, computer, and things like this. It's actually making bana ba gore ba be myopic. And the problem with myopia, as I've already said, it's starting to be a public health crisis. Ki ya gore the studies ti ikomba ku year 2050 half ya vanhu hinkwavo lava nga ta va ri kona misaveni va ta va ri myopic. So it's something that we need to really deal with. So advice would be that bana loko va kha va ti huhela va fana va encouragewa ku na ku huhela a handle, at least va be exposed to some level of UV which excites which excites some form of vision. So loko hi vulavula hi ti visual display terminals ti lead ka something lexi hi xi vitanaku computer vision syndrome. And syndrome, as per the name, is a group of conditions that can happen ku ya hi ku baba exposed kufika kwihi. So computer vision syndrome yi affecta mahlo hi tindlela to hambanahambana. Mahlo ya nga va strained, mi nga kuma ku se ku na ku panda hi nhloko, ku va na ti-headache, blurred vision, as we are on the topic here, blurred vision. But as well, it affects the musculo-skeletal part, or skeletal, both the systems, skeletal and the muscular, because loko iri ka computer laya, mkarota la itama igobeka, itami up straight, ibeka akswan nguvu na mahlo. Tilaba tibekwa around 50 to 70 centimeters. And munatama aba ati gedlini aba asapotekini with a back on the backrest ya stool at a proper angle. Na screen leshia shiba same at an angle which usually is about 15 to 20 degrees. It does help. And loko meshi nangutse kahle mtasubona ku loko mirka computer mahlo aya blinky as much as it used to. So the layer ya tear layer, the tear film, is not continuously being renewed. It's not continuously being renewed. So we induce conditions such as dry eye. And dry eye is very, very common. It's very, very common, and sometimes we even underplay the importance yakuba dry eye treat you. So it is important ku loko yikaitra akati computer because the computer ti emitter lights, blue lights, UV lights, which are actually found to cause problems at the level ya cornea, legal lens, even at the back. Loko nanguta lega at the back, laba kabalola kona Dr. Phathudi at the macula. That part gets bent over time. The cumulative effect, it may not happen immediately, doc. It's a cumulative effect. Iva kona ekuba munu aba are exposed to these these light rays. Na cataract leba kabay bulabla yon. It's because the lens iba kai ringeta ku protector the back part of the eye. That lens le affect ka ekuba ikai la pfuna the retina kuba protected ku ngabina those conditions ta kufana na bo age-related macular degeneration. So he absorb those lights, the blue lights, including na UV. Then it leads to cataract. So it's important ku hiva hi mbala ti hi chekiwa hiva hi kuma ti glass leti nga ku ti endleliwe ku ti ta absorba na ku reflecta light leyi nga ku a yi laveki, because a swi twisisa ku light yi fana yi va koho mara ku na light leyi nga lavekiki, ku na light leyi lavekaka, ku na leyi nga lavekiki. So hi swo sweswo ku ba chekiwa ba kuma ti glass leti nga ta va na mindzhuti yo karhi, ti anti reflective coatings ku ti light letiwa ti nga va affect.
Sibonge kakhulu Mr. Audience Maluleke nakuwe Dr. Phathudi, ngibonge isikhathi senu. Kanti nawe lapho mbukele ekhaya ngibonge ukusipha indlebe. Sithi ku Dr. Prue ezempilo zamodakalo sibonga kakhulu, niphinde nilalele ngokuzayo. Ngiyathemba ukuthi nifunde kakhulu namhlanje, kanti siyazi ukuthi uOctober bekuyinyanga yethu ekuthiwa yi-vision awareness. So ukusukela namhlanje usuyazi ukuthi fanele unakekele kanjani ilihlo lakho noma amehlo akho. Nisale kahle balalele emakhaya, niphinde nivulele ezempilo zamodakalo with Dr. Prue.